Hi, I'm Dr. Rasya from Dr. Dixit Clinic. I'm a dermatologist in private practice from the last 15 years. What causes facial pigmentation? Facial pigmentation is a very wide umbrella term under which there are many reasons and causes for the same. One of the common things that patients come and tell me is, Doctor, I went into the sun and I got a tan and I got a facial pigmentation. The facial pigmentation is a very different entity than tanning. Tanning is what happens after a period of sun exposure, and it is a uniform event. It happens all over the body, whichever area is exposed to the sun, and it's a uniform color which becomes darker. And over a period of time, the tan lightens even without any treatment. But pigmentation is something which is more patchy in nature. It can start only on one part of the face and extend into the other parts of the faces. And today we are talking about the common causes of facial pigmentation. One of the most common causes of facial pigmentation is a condition known as melasma. Melasma, which is a hormonal pigmentation, is a uniform pigmentation usually seen on the cheekbones, on the sides of the face as well as on the nose, and it's also called a butterfly pigmentation. We have seen this very commonly after pregnancy. It can occur even in men, but it is relatively uncommon in men and more common in women. This pigmentation has to be treated with a combination of sunscreen and skin lightening creams, and in some patients may need chemical peels and lasers as well. The other things that we see, which is other common causes of pigmentation, is post-acne or post-inflammatory hyperpigmentation. In some people who are dark-skinned, skin can go dark post any inflammation such as acne, especially if they pick at it or if they have been putting something which is harsh to treat the acne. And this has to be treated with a combination of sunscreens, emollients as well as skin lightening agents, and it may benefit significantly by the use of chemical peels as well as lasers. The third and the most common cause of pigmentation that we see is Acanthosis Nigricans. This is when a person gains weight, and this over a period of time the insulin causes a pseudo hyperpigmentation or the thickening of the skin, commonly seen over the cheeks, the under eye area, the back of the neck and on the knuckles. The treatment here of course is to reduce the weight, but we can help with the cosmetic improvement of the skin by using stronger chemical peels. Like now you have seen, there are so many causes of pigmentation. It is very difficult to treat them with a single cream or a single treatment objective or a single chemical peel. What has to be done, however, is to make sure that you diagnose what is the root cause of the pigmentation before you start to treat pigmentation.